Think we can all do the first line together. When I was 2.5 years old, good. You guys are really good. We're locked in. My observant mother saved my life. She had taken pictures of me at Christmas time. And when she got the photos developed, she noticed that my eyes looked different. One had the usual photo red eye. The other looked almost silver. And my mom's not a physician, my cousins are. Neither is my dad. My parents thought this was odd, so they took me to the eye doctor. There, to check my vision, they covered my right eye and had me identify images projected on a screen. Dog, apple, house. I was delighted to name the images correctly. Then they covered my other eye. They flipped through a few more images, returning to the ones I had so enthusiastically named before. Nothing. Imagine being my parents and realizing your child cannot see. Mine were confused. They were scared. They were crushed. They were told I had retinoblastoma. I had lost all vision in my right eye, and it would have to be surgically removed. But after the surgery, there was good news. The margins and the other eye were clear. The disease had been caught in time. A marvelous ocularist painted me a beautiful prosthesis, and life went on. My name is Elyse Portillo. I am a one-eyed doctor, and this is my story. Years after my surgery, my parents confessed to me that their worries hadn't ended with the clear margins and the surgery. They had worried about my limitations. They worried I would be teased, worried I would struggle to make friends, worried I would have a tough time in school, in sports, and perhaps in dating. But my parents never shared any of those worries with me. They instilled in me a strong sense of self-worth, a strong work ethic. My parents told me I could do anything I wanted. And for the first 22 years of my life, I never doubted it. I excelled in school, I made lots of friends, and I was even pretty good at sports. Despite the doubts of others, I tried out for the ultra-competitive cheerleading squad at my Texas high school. I made the team and was even varsity co-captain and an All-American. Thank you. It was a big deal back then. But then, medical school happened. I started off interested in pediatric ophthalmology for obvious reasons. Our histology professor raved about ophtho being the most magnificent of specialties. So I confided in him one day after class that I was interested in the field because of my personal history with retinoblastoma. He didn't miss a beat. He told me I should think about a different field. The intricacies of ophthalmologic surgery, he said, required the use of microscopes, and with one eye, I wouldn't be able to perform them. I left the auditorium feeling rattled. But I had faith in myself, and like high school cheerleading, I wanted a tryout. So I went to an ophtho wet lab, where we placed tiny sutures in pigs' eyes under a microscope. And I'm not gonna lie to you, I was great at it. And in between turns, I watched as my colleagues, each with 2 magnificent eyes, struggled to place the sutures, and I convinced myself that histology professor is wrong. I can still do anything I want. But as medical students are wont to do, I changed interests a few times over the years. During a 3rd-year ENT rotation, I was fortunate to have a whole week in the pediatric ENT OR with a well-respected attending. She was awesome. She was a woman, and I was ready to wow her. Before our first case, I told her of my interest in PDENT. And she asked if I had a mentor in the field. This is it, I thought. That magic moment when someone amazing actually offers to mentor you without you having to awkwardly ask them. I told her I didn't have a mentor in PDENT. She looked at me. I held my breath. "I'm sorry," she said, "but you cannot do otolaryngology. You only have vision in one eye, right?" I nodded. "I'm just so sorry. You should talk to the dean about other options." She turned and walked into the operating room. This time I wasn't just rattled. This time I was crushed. This time it wasn't the histology professor who had never wielded a stethoscope or needle drivers. This time it was a strong, intelligent, well-respected female surgeon telling me I was wrong. I could not do anything I wanted. And she hadn't even let me try. Later that afternoon, I cried in the resident workroom for the first and only time in medical school. I met later with the dean, who said he disagreed. He knew someone with monovision who had gone into otolaryngology and excelled, and he would have the faculty critically observe me for the rest of my rotation so they could vouch for me when the time came to apply to residency. But again, as you, astute crowd, have realized, it would be odd for me to be speaking at this conference. I guess not so odd, given some of the other speakers, if I had gone into ENT. For the rest of medical school, my love for pediatrics, my interest in public health, and my desire for clinical variety ultimately solidified my training pathway. Pediatrics residency, followed by Peds EM fellowship. And during that graduate medical training, something extraordinary happened. People stopped telling me what I could and couldn't do, and just let me try. I was given the space to engage with my patients, and I did it well. And this brought me to a remarkable conclusion. I am not an effective clinician despite having one eye. Having one eye, something that makes me different, something that others view as a disability or a deficiency, is at the core of what makes me a compassionate and effective physician. And many of you today have reached a similar conclusion about your gender identity. We are not amazing emergency medicine clinicians despite being women. Our identity as women is at the foundation of our effectiveness and informs some of our finest abilities, like empathy, intuition, and persistence. Our identity makes us damn good doctors. But medicine hasn't always bought our conclusion. And I would argue that we still have a long way to go. The existence of this conference and the makeup of its audience tell me that medicine is starting to get it. Medicine is starting to realize that groups it once thought unequal to the noble task of the profession of medicine, groups like women and minorities, actually make great doctors. But we can't stop there. Diversity is more than skin deep. We need to continue to expand our definition of diversity to include traits that aren't always readily apparent or that make us feel uncomfortable. Physical disability, mental illness, sexuality, economic disadvantage. We need to recognize the incredible value to our patients when their providers have felt what they feel. I can say in my own practice that some of my most powerful connections with patients have been forged by acknowledgement of my own medical equipment and my experience as a patient. Similarly, a colleague I work with practices family medicine in a wheelchair, and she says that her patients look at her with a sigh of relief. They know that she knows what it's like to be a patient. And better yet, she says, she can't help but talk to her patients on their level. Which is funny. As I reflect on my own story, It's easy to glorify my family, my friends, the dean, the folks who believed in me, and to vilify the doubters. But the doubters had really good intentions. They feared for me that I would be unable to do this job well. But they're not unlike physicians of the past who feared that women and minorities would not be able to do this job well. My doubters committed that same fallacy. They labeled a characteristic a deficiency solely because it was a characteristic they did not possess. My doubters were so consumed with how I would see, with how my vision might be different than theirs, that they never stopped to ask what I see. They never realized that what I see as someone who looks a little different, as someone who has been a patient, has the profound ability to impact my connections with the patients that I serve. FIX18 attendees, please do not make the same mistake as my doubters. Please do not label a characteristic a deficiency solely because you don't possess it. Don't mistake different and deficient. Don't consume yourself with how someone will do this job. Give them a try and let them show you what they can do. But don't stop there. I was given a lot of chances to show what I could do, but I took those chances because of cheerleading from others. My believers lifted me up and helped me realize that what others viewed as a deficiency was really my strength. We can all be cheerleaders. We can flip the narrative and show the world that there is no ideal shape, appearance, or gender associated with being an effective physician. We can build up those who would come behind us in this profession, and as we do that, I see a medical profession where different is not mislabeled as deficient. I see a medical profession where different is not just tolerated, it's celebrated. My name is Elyse Portillo, and this is what I see.